Hello students, welcome back to our channel. In today's topic, we are going to discuss about the amputation, review principle and physiotherapy management. So what is amputation? Amputation is the surgical removal of a part or whole of a limb due to disease or any trauma or congenital reason. It may involve upper or lower limb and is classified based on level, example above knee, below knee, etc. Indications for amputation, for whom we can proceed for an amputation. So amputation, it's not a small thing, it's a great deal. Living a life without any part of the body, it's not cool. So indications for amputation: trauma or the severe crush injury, fracture, burns. If it's trauma, PDV, peripheral vascular disease, infection, malignancy, congenital anomalies, frostbite or electrical burns. When we talk about PVD, diabetes, arthrosclerosis, especially in lower limbs. So gangrene, osteomyelitis, necrotizing fasciitis will be seen in severe crush injuries, fracture and burn. Bone or soft tissue sarcoma, deformed or non-functional limbs, tissue necrosis. So, what are the principles for amputation surgery? Is to preserve the maximum limb length. We can't remove just like that. Create well-shaped stump for the prosthetic fitting. If we provide a good stump, then the prosthetic fitting will be is of a new journey for them. Maintain adequate blood supply, smooth bone ends, proper muscle retachment, myodesis or myoplasty. Ensure pain-free healing. Prevent neuroma formation, nerve ends retracted and embedded. Common levels of amputation. Lower limb. In lower limb, we'll remove just only the toe. If in cases of diabetes, we can see one toe was removed, the main toe was removed, like that they would usually used to say. Partial foot or rare resection. Sims prosthesis, for the Sims amputation through the ankle joint will remove. Below knee, that's the transtibial, preserve the knee joint. Above knee, it's transfemoral, through the femur. Hip disarticulation through the hip joint. And when we talk about upper limb, partial hand, fingers and palm. Wrist articulation at wrist level will remove. Below elbow transradial through forearm, above elbow transhumeral through arm, shoulder disarticulation at shoulder joint. Physiotherapy management, pre-operative PT goals, patient and family education, maintain joint range of motion and strength, teach bed mobility, wheelchair use and transfers. Psychological support should be given. Post-operative, pre-prosthetic PT. Focus on positioning. So the position should avoid contractions. No pillow under the stump in BK amputation. BK, that is below knee amputation. Edema control, elastic bandaging, stump shrinker, elevation. Pain management, tense, desensitization, mirror therapy for phantom pain, wound care, monitoring healing, avoid pressure, range of motion exercises for active and passive for adjacent joint, strengthening of both the affected and unaffected limb, stump care, massage, tapping, scar mobilization, balance and transfers, mat activities, parallel bars training, mobility training with walker crutches before prosthetics. Prosthetic fatigue PT management, for prosthetic gait training with or without assistant devices using mirror parallel bars. Donning and tuffing, teach correct methods. For prosthesis, for stump inspection, check for pressure points, skin breakdowns, functional training, aerial with the prosthesis will be given. For balance and coordination, static and dynamic balance will be given. Endurance building, gradual ambulation and activities. Psychological rehabilitation, acceptance of body image, confidence building. Immediate post-operative prosthetic fitting, IPOP. Definition is a rigid dressing with a prosthetic pylon and foot is applied immediately or within 24 to 48 hours after amputation. Advantages: early weight bearing, promotes confidence, decreases the bed rest. Reduces edema and pain through compression, decrease phantom limb sensation by early stimulation, speeds up rehabilitation, early gait training, promotes faster wound healing, controlled environment, maintain the stump shape, better prosthetic fitting later, improves psychological outlook, immediate body image replacement. Home program. HEP for range of motion and strength will be daily exercise for hip, knee, shoulder, elbow, stump care for clean, inspect, moisturize, scar massage, prosthesis care to check alignment, socket fitting, hygiene, gait practice, indoor walking, star climbing, aerial training, dressing, bathing with the prosthesis, community reintegration, encourage the independence, workspace adaptation. So let's summarize the entire 5 minutes of what we have discussed. So indication, why it's amputation and its care. Okay, why it's indicated. Amputation is indicated for trauma, infection, PVD, peripheral vascular disease, malignancies, any tumor. Surgical principle to maximize the limb function and shape the stump. PT pre-operative education, strength and range of motion. Post-operative edema control, range of motion, pain and mobility. Prosthetic rehab for the gait, donning interfin training, endurance. For IOP, that is for early stages, that immediately after the post-operative care of prosthesis, faster healing, less phantom pain, early rehab can be required. Home program, self-care, exercise, mobility, and prosthetic care. So this is the quick revision. If you want to take notes, you can just pause the video and take notes. And also, if you want to make me a detailed video for each and everything, please do leave a comment. We'll discuss in later stages. Happy learning.